If you're researching veneers, porcelain veneers, composite veneers, smile makeovers, or cosmetic dentistry, one of the biggest mistakes that you can make is assuming veneers are just a quick way to get your perfect teeth. And I get why people think that. You see before and after photos online, you see celebrities with these like bright white smiles, perfect smiles, and it can look like veneers are these simple things that you walk into the office, you walk out, you get a brand new smile, and you just pay money. And yes, veneers can be amazing. They can completely change the shape, color, size, and overall appearance of your smile. But veneers are also a real dental procedure. They require planning, they require the right diagnosis, they require the right dentist. And they're not always the right solution for every single person. So in this video, I want to walk you through the 5 things I think every patient should know before getting veneers. Because before you make a decision that affects your smile, your teeth, your bite, and your long-term oral health, you should understand what veneers actually are, who they are for, who they are not for, and what it takes to keep them looking good over the long term. My name is Dr. Chris Bono, and I'm a dentist here at Centerville Family Dentistry and Implant Center in Centerville, Michigan. At our office, we help patients with everything from general dentistry to cosmetic dentistry to Invisalign to dental implants and full mouth treatments. And when someone comes in asking about veneers, the first thing that I want to do is understand why they don't or what they don't like about their smile, what their goals are, and whether veneers actually make sense for their mouths. Okay, so let's get into it. The first thing that you need to know is veneers are not just fake teeth that you glue on top of your teeth. A veneer is usually a thin layer of porcelain that is bonded to the front surface of your tooth, and the goal is to improve the shape, color, and size and overall appearance of that tooth. So if someone has teeth that are chipped, worn down, slightly uneven, discolored, veneers can be a great option. But here's the part that people don't always realize. Most veneers require some level of tooth preparation. That means we may have to remove a small amount of enamel from the front of your tooth so the veneer has room to fit and look natural. It's usually much more conservative than a dental crown, for example, because we're not covering the entire tooth 360, but it's still a permanent change to the tooth, and that matters. Because once enamel is removed, that tooth will usually need some type of veneer restoration over the long term. So, this is not something that you should do casually just because you saw a smile makeover online. You need to think about it. The goal of veneers should not be to make your teeth look fake or bulky or overly white. The goal should be to create a smile that fits your face, your lips, your bite, and your personality. Because a great veneer case should not like scream, I just got veneers, right? It should be like you have a beautiful, healthy, and natural smile and people love your teeth. And the second thing that you need to know is veneers do not always fix or do not fix unhealthy teeth. And this is a big one. If someone has active decay, bleeding gums, untreated gum disease, loose teeth, or major bite issues, or teeth that are breaking because of grinding, veneers may not be the first step. In fact, doing veneers in that environment, in that situation, you can actually create more problems. And before we talk about veneers, we need to make sure the foundation is healthy. That means looking at the gums, checking for cavities, evaluating your bite, looking at the enamel, checking for old fillings, making sure that the teeth are strong enough to support veneers. Because it does not matter how pretty the porcelain is if the tooth underneath is not healthy, right? It's just going to fall apart at some point. Patients come in wanting veneers, and after we evaluate everything, the first or the better first step is whitening, or sometimes Invisalign. And sometimes after those things, the patient realizes they don't even want veneers at all, or they may need fewer veneers than they originally thought. So before getting veneers, ask your dentist, are my teeth and gums healthy? Or is there anything we should do to fix first? Or would whitening or Invisalign help before I get veneers? Am I just a good overall candidate for them? Because veneers can make a healthy smile look better, but they are not a shortcut to getting around getting the mouth healthy first. And the third thing that you need to know is not everyone needs the same type of veneer. When most patients say veneers, they're usually talking about porcelain veneers. Porcelain veneers are custom made by a dental lab. They're amazing. They can look extremely natural, and they're usually stronger and more stain resistant than composite veneers. For bigger smile makeover cases, porcelain just gives us more control over the color, the shape, the length, the width, the symmetry, and the looks of the teeth. But porcelain isn't the only option. There are also composite veneers or composite bonding, and that is when the dentist uses tooth-colored filling material to reshape or improve the appearance of the teeth. Composite is a great option for smaller changes. things like minor chips, small spaces, or uneven edges, or patients who want a more conservative, quicker option. The benefit of composite is that it can be often done with little to no tooth reduction, and sometimes it can be done in one visit. The downside is usually composite does not last as long as porcelain. It can stain or look dull over time, and it's usually very technique sensitive to look good. Porcelain veneers, on the other hand, are usually better for bigger changes if we're changing the shape, the size, the color, the symmetry, and the overall smile design. Porcelain just makes more sense in that case. But the question is not just, should I get veneers or should I get porcelain veneers? The question is, what cosmetic treatment actually makes sense for my situation? And your dentist should be able to answer that for you. And that is why a good cosmetic consultation should not be rushed. Your dentist should be able to explain the difference between porcelain veneers, composite bonding, crowns, whitening, and Invisalign orthodontics. Because in cosmetic dentistry, the best option is not always the most aggressive option. The best option is the one that gives you the best result you want while preserving as much healthy tooth structure as possible. And the fourth thing that you need to know is the planning matters just as much as the veneers, like you're planning a home. This is where great veneer cases are made. A lot of people, they just think the process is prepare the teeth, get temporaries, send it to the lab, cement the final veneers. But if you want like a beautiful result, there should be planning before the teeth are even touched in your mouth. We need to know what the smile we are trying to create is going to look like. How long should the teeth be? How wide should they be? How much tooth should show when you talk? How much tooth should show when you smile? Does the smile match your lips? Does it match your face? Are the edges too square? Are they too bulky? And so on and so on and so on. These details matter so much. In many cases, we may use photos, scans, digital smile designs, wax-ups, a mock-up to preview your result. A mock-up is basically a way to test and test drive the smile before the final veneers are made. And that is important because what looks good on one person may not look good on another person. You're not going to get copy-paste veneers, or at least you shouldn't. Not every patient should have the same bright, white, square, Hollywood-style smile. Some people, they look better with softer edges. Some people look better with a more natural shape. Some, they just need a little bit more length. Some need less length. Some people want bigger changes. And some want people to just simply say, you look great, but they don't know exactly what changed. And that is why communication matters so much on the front end. Before getting veneers, talk with your dentist about what you like and what you don't like. Bring photos, talk about shape, talk about shade, talk about whether you want natural or bold. Talk about whether you want a big transformation or something a little bit more subtle and natural. And your dentist should also be honest with you. Some patients want teeth that are too white for their face, and sometimes they want teeth that are too long, okay? Sometimes they want a shape that looks good in a photo but doesn't function well in real life. A good dentist should be honest with you and should guide you through that. Because veneers are not just about making teeth white. They're about designing a smile that looks good and functions properly for many years. And the fifth thing, the last thing that you need to know is veneers still need maintenance, like everything in life. This might be the most important thing to understand long term. The veneers are strong, but they are not indestructible. They can chip, they can debond, they can crack, the tooth underneath can get decay, the gums still can get inflamed, and if you grind or clench your teeth, you're putting a lot of force on those veneers. So after getting veneers, you still need to brush, you still need to floss, you still need to take care of your teeth, you still need regular cleanings. And in many cases, you probably should be wearing some sort of a night guard, especially if you clench or you grind your teeth. And you also have to be careful with certain habits. You can't bite your nails, you can't chew ice, you shouldn't open your teeth to open packages or bite into things that are really hard with your front teeth if your dentist tells you not to do that. Veneers are designed for smiling, speaking, and normal function. They're not tools. And you should also understand that veneers are not necessarily forever. They can last a long time when they're planned well, bonded well, and maintained well. But like anything in life, they may need to be repaired or replaced at some point in time. So before getting veneers, ask yourself or ask the dentist, how do I take care of these? Do I need a night guard? What happens if one chips? How often should I come in for cleanings? What should I avoid? And what should I expect years down the road? Because getting veneers is not just about the day that they're placed in your mouth. It's about keeping them healthy, beautiful, and functional for many years. And you should not feel rushed. You should not feel pressured, and you should understand exactly what is happening before you move forward with the procedure. At our office, when someone comes in asking about veneers, we start by looking at the full picture. We look at the teeth, we look at their gums, we look at the bite, we look at the patient's goals, most importantly, we discuss options, and then we help them decide what actually makes sense for them. But the goal is always the same. Create a smile that looks good, feels good, and is built on a healthy foundation that will last many years. So if you've been thinking about veneers or you're unhappy with the size, shape, color, or overall appearance of your smile, reach out to our office. Even if you're just starting your research, that's completely fine. We can at least help give you the clarity and walk you through what your options are. Until then, I'll see you in the next one.